Welcome to today's Aquila University. This is the final part of our four-part series on various publishing methods. Today we will be discussing using a publishing partner. A disclosure, we are recording this meeting. If you are concerned about using your name, your question, and of course the answer in our website, please disconnect now and you receive an email when this video is available online. Also, as a note, we do offer publishing services, and since this training is about using publishing partners, everything should be taken with that view in mind. However, we have been in this field for quite some time and have helped a wide variety of clients. My name is Josh Boutwell, and I have been in regulatory affairs for about 15 years. I founded Aquila Solutions in 2010, and as I've already said, we have spent much of that time helping a wide variety of clients, not just with their publishing, but also integrating publishing systems and any upgrades or regulatory operations support that they need. Topics. First, we're going to talk about the four publishing methods. This is just a brief overview for reference. We're going to discuss what a publishing partner actually does. We'll discuss how you would go about selecting a partner and what's involved in integrating that partner into your business practice. We'll discuss some things to consider for cost, for the pros and cons of using a publishing partner, and there will be time for questions at the end. So, publishing methods. As everyone knows, sponsors are required to submit things to the FDA and other regulatory authorities. This is typically done in ECTD, the electronic standard. Some of the things that all systems have to provide, no matter whether you're outsourcing or you have an enterprise-based system that integrates everything from your lab research up through your clinical studies and final management. You must be able to include your regulatory strategy. So how are you going to approach winning approval for your product? Or you need to be able to manage and plan the life cycle. How to update the product? How are you going to make sure all your documents are complete and up to date? You have some project management. Without project management, your projects will be many, many times more expensive if they even succeed at all. Of course, document tracking. These applications can be anywhere from a couple of documents to literally thousands. And without document tracking, you're very likely to end up submitting something that is incomplete or worse, even worse, inaccurate because it's since been updated. Document remediation. And this is the step most people think about when they talk about ECTD publishing. This is the linking and the bookmarking and the granularization and all of that. You need to do QC, so you need to go through your submission and make sure it's saying what you want it to say. And then finally, you have to actually get it to the FDA or whoever else, typically through an electronic submission gateway or some other method. These are true of every single publishing method. There are methods that are available, and I've broken it down into four. There are some subdivisions, but everything really falls under one of these four categories. There's desktop. There's a software installed on one person's computer. That person creates submissions. There are enterprise, which are server-based submissions, based applications. that actually connect to through an internal web page, and it allows multiple users to work on a system at one time, and can also help unify your entire process from the research up through the marketing. This SaaS, software as a service, also known as the cloud, this is where you are renting someone else's installation of their enterprise system. It provides the same features as an enterprise system as with a very different price structure and a very different risk structure. And then finally, there's what we're going to be talking about today, which is outsourcing, where you use an outside publishing partner. Publishing partners actually do. So, publishing partner is a third party that manages your electronic publishing. And just for clarity, it means outsourcing. Capabilities that are absolutely required for a publishing partner, that you would want to use. Number one, they have to provide expert advice in ECTD, SPL, and other standards, and not just for the U.S., but they need to be able to understand the standards as they relate to other countries and a wide variety of products. They're able to work with any document type, even more difficult ones like XPT and the XMLs for CDISC. Of course, they have to be able to do the remediation and ideally perform the remediation in a time-effective and cost-effective manner. They create your XML backbone and a variety of tools. Some providers use off-the-shelf tools. Providers like Aquila use internally developed tools. Your provider needs to do an extensive QC on your submission before you get to see it. And once it's been approved, your provider should be able to submit it on your behalf, whether to the FDA's ESG or some other method, depending on the region. And just the true advantage of using a third party is that they provide extreme flexibility. They should be able to accommodate what bothers you, and within reason, your schedule and your standards. If it exists, then you may need to look for a different partner. This example of the workflow you can expect working with a quality publishing partner. This is how Aquila operates, and most other well-established publishing partners use a very similar workflow. First, the sponsor talks to the project manager at the company. Aquila, we call them lead publishers. They lead the publishing effort. And the initial conversation includes the sponsor's timeline, some details about the submission, and anything else that might be of use for that sequence. Internally, the manager then starts the project internally, while at the same time the sponsor begins sending the related documents to the data center for the provider. You can use a variety of methods. You just want to make sure it's secure. It uses anything from email to a secure FTP server to SharePoint and other advanced document management systems. Once the documents are available, the Aquila project team can create the sequence, and this is where the remediation and is done, backbones are done. That's done. A full QC is conducted. constructed, where we go through every page, every link, make sure everything is in the right place and goes to the right place. Then our project manager has final approval, internal approval of your submission. Project manager approves, it is sent to the sponsor for approval. And at this point, you look through it, and if there's anything that you would prefer to see some other way, we will apply those changes. If you send us authorization, and we will then submit it on your behalf. Or if you prefer to submit it yourself, that is perfectly fine as well. That gives you an idea of the overall workflow of working with a third-party provider. At this point, the only thing the sponsor is involved in is, number one, kicking off the project and authoring the source documents, and final approval. So, very easy relationship for the sponsor. So, common components of a publishing partner. So, number one, you have to have secure file transfer. Like I said, we use a variety of systems. It really depends on what your requirements are as far as security, but make sure it's secure. Your needs to have extensive experience in a wide variety of submission types. Of course, all necessary systems. This is the CTD publishing software, the PDF manipulation tools, validation tools, anything like that. And there should be prompt turnaround. And for Aquila, we typically turn around small submissions same day. But it will, of course, depend on size. You need to make sure that you can accept the turnaround time of the partner that you're working with. Additional components that you will need to provide. Secure one way or another. First is a secure file system. This is your file system, not your partner's file system. You make sure you are keeping your documents secure. I strongly recommend that you procure a set of ECTD templates to assist with your authoring. This will help your authoring much more quickly, and at the same time, it will help standardize your submissions across different applications and obviously across the years. Finally, you really do need an ECTD viewer. Aquila provides one for free. There are a few other free options, and then, of course, there are some that you can purchase. Section and integration. How do you go about deciding what partner to use? So these are some things that you should expect. So number one, there should be no setup costs whatsoever. If the potential partner is asking you to spend money to send them work, then we'll give you an idea of what they're looking for, how they'll react from then on. They will always be budget conscious. They won't necessarily be willing to help you at any time in any way. It shouldn't cost you any money to move your application to a new printer. You should be willing to provide some basic training. This is not just training in ECTD, but also in training in their systems, some basic methods of QC. Honestly, anything that you have a question about, you should be able to call up your provider and ask them a question without worrying about getting a bill. You should not have to have anything more than Word and an internet connection, and of course your secure file system. Can't expect publishing partners to have a minimum standard. This is not necessarily this is in order to protect you. And this, you want your publishing partner writing your documents unless you specifically hired them to do that. With that in mind, most publishing partners are not willing to do major edits on source documents. And so they only look at what you provide and tell you whether the FDA or whoever else will accept what you've printed. So, for instance, legibility. This is very important on older reports that were paper and then scanned. If the scan is not high enough quality, you won't read it. And it's sort of pointless submitting something that can't be read. The FDA will ask you about it. And expect your publishing partner to kick that document back to you and ask you to replace it. Clarity. This means, are the documents, is the content placed in the right document, and are the documents broken down into a way that is easy to maintain? And this is defined by FDA and other international groups. And it's really the publishing partner's job to make sure that content is presented in the correct way. Format. Does the document look good? The publishing partner is creating your links and your bookmarks and your headers and your footers, but they also go through all the documents. They know if Word documents, the captions on your Word document don't match up with the tables. They either be able to be authorized to update it themselves or to send it back to you for correction. Now, expect you should not have to add an headcount if you're outsourcing. That is one of the big pluses of outsourcing. You don't have to have people dedicated to it. You don't have to have extensive experience. That's what the publishing partner is doing, is providing to you. So, in mind, the author will need to specify a primary contact. Typically, this is a regulatory manager or a director level person. It would be the person who's managing the application. Will still have responsibility for authoring. Now, we outsource it, and some publishing partners like Aquila do provide authoring services, but it would be a separate discussion. And you will, of course, always require the final QC responsibility. This application is in your name. You need to make sure that it's correct. One thing that is useful but is not required, I said you don't have to have expertise in ECTD, but having people that are familiar with it is very helpful. It prevents a lot of rework on both the sponsor and the publishing partner's part. You also expect clear delivery time. The publishing partner needs to give you a table that tells you how long it'll be for a submission to be turned around. And this can be anywhere from a couple of hours to a week to months to the size of the submission. But they need to provide it. It's always important to remember that large submissions are always going to be special projects. They're always going to be separate from anything that's really predictable. So expect some customized timelines for that. Finally, no upcharges. You should not charge you anything extra for sending ESG submissions on your behalf, or again for onboarding, or anything as silly as storing your application or anything like that. If they are trying to nickel and dime you, don't use them. Now, some calculations just to consider. First, pricing scheme. There are a few common pricing schemes. This is, of course, hourly. This is standard consulting billing practices. This is a per page, where the publishing partner actually counts the number of pages you send them, and that's what determines the fee. This always comes with a minimum rate. There are per project rates. For large projects, your partner will make a formal bid for the work with a timeline, with costing projections and invoice schedules and all that sort of stuff. And of course, there may be some other pricing schemes that I haven't mentioned here. You'll want to know the details of that. Next, are they available? Do they answer the phone and email? The phone when you call, and do they respond to your emails promptly? Will they provide advice to you for your client? And so if you call up Aquila, I will be happy to discuss, to provide advice for you, even if you decide against using us. That's a service we provide, and you should expect that from the people you are thinking of doing business with. Three, is the organization large enough and organized enough to be able to turn around your submissions in a reasonable time? Can handle your volume? I mean, a one-man, two-man company that has one submit a year, that's one thing. But if you're a company with a dozen active products and half a dozen development products with 10 submissions a month, you make sure that your publishing partner can handle all that work. For all you know, your 10 submissions will come on one day. They'll be able to handle that. And wanted to look at what other services they provide. Do they provide general consulting services, medical writing, provide QC, auditing, and just other general regulatory services? It can help to use one company instead of several. What are some typical cost structures? An hourly rate are typical consulting rates, and I've seen anywhere from $100 to $180 an hour. It can vary depending on the skill level and proficiency. Most publishing groups don't tend to go by hourly rates, but some do, and they'll certainly quote them. Your per-page rate, and there is almost always a minimum fee, an added fee for each page. So minimum fees that I've seen are anywhere between $800 and $1,000. Is that for every submission, you will spend $800 to $1,000 at least, if that provider. The typical per-page fee, and then on top of that, per-page fee is usually $2 to $5 per page. This is the method that Aquila recommends. These are actually significantly better than the average. And the way we structure it is there's a minimum fee, and then after you enough pages that your per page rate would have been the minimum fee, then we start counting pages. Then a per project. And this is a formal bid process, and so it's really heavily dependent on the project that you're talking about. But some of the ranges that you can expect to see. 505B1, depending on the complexity and the size, it's anywhere from about $100,000 to maybe $400,000 project. A few can range, again, from complexity standpoint, from $30,000 up to maybe $400,000. And very rarely get above $100,000. Most phase one INDs, you're looking at $2,000, maybe a week or two, and phase threes are often $10,000. I've seen some quoted at $15,000 and $20,000. Pros and cons. Startup costs. If you submit electronically, all the stuff will submit it for you today. We also provide extreme flexibility. Not only are you not tied down to a system that you purchased, and you also have some influence over how the will interact with your organization. Of that, there's always the option of transitioning to a different partner if you're unhappy with the service you're getting. If you've purchased software, you have a huge amount of sunk costs that make it much more difficult to transition. Partner is effectively infinitely expandable. You can throw as much work as you want at a quality partner, and they will thank you for it and turn it around at the same quality. Without you having to do anything different. If you purchase the system, you'd have to upgrade the system in order to handle the workload. And partners are experts in their field. They do this every day. They're managing dozens to hundreds of applications for all sorts of different areas. They have the expertise, and you now have the expertise because you're working with them. Cons. Public partners are outsourcing. By its very nature, outsourcing is almost always more expensive than insourcing, so long as you're actually fully utilizing the systems that you've done internally. So, for instance, an internal system will require you to hire a couple of people, buy the software, buy the equipment, and all of that. And the salaries for the people and replacement and maintenance for the systems are ongoing expenses. Have enough submissions to warrant the savings for savings you would see to justify using those systems. Otherwise, you're more expensive. But if you're actually using the systems close to full capacity, it will be much cheaper than outsourcing. Next, you have very little control over the tools and procedures used inside the publishing partner. Now, this really shouldn't matter because the product is what really matters. But I do know some sponsors that are very concerned about which system is used for their applications and things like that. Advice is publishing partners are ideal for small to medium-sized companies. This is because you don't have to hire people, you don't have to sink any money into anything. You get the advantage of experience without the disadvantage of cost. Unless you're doing a lot of submissions, it's almost certainly going to be cheaper for you anyway. The caveat is, if you're creating more than about 150 submissions a year, so then 12 to 15 submissions a month, or you're expecting to do at least one major initial application a year. And by that, I mean the 300,000 to 500,000 page NDA or BLAs. If you do that every single year, then it makes sense to have an internal system and the staff that goes with it. And below that, then from a strictly financial standpoint, it's better to outsource. Now, I know a number of sponsors that have made the business decision to insource your publishing as a critical business function. And it's certainly a legitimate approach, but it's not. It is a negative financial approach. Are there any questions? If you have any questions in the future, please do not hesitate to call us. Again, we do provide publishing services, and while we understand the pricing to be competitive, to be representative of the industry as a whole, they aren't our prices. Our prices are actually significantly more competitive than what we quoted here. And be happy to speak to you if you have any questions about what we do or any other area that you may have a question about. Our next university is on February 12th, and we'll be discussing the FDA's ECTD mandate, and specifically, how do you convert your existing paper applications to ECTD? Well, it theoretically is very simple. Like everything else in reality, there's a lot of things to consider, a lot of things that can go wrong. And thank you for joining us today for this current